We haven't all been there, but for those who have, the moments before receiving anesthesia can be pretty scary. But what about the moments as you go unconscious under the pain-relieving drug? In this episode of Mostly Health, we will dive into what happens to your body as you go under anesthesia. General anesthesia makes you go through 4 basic phases, among which 3 of those are occasionally experienced by most people. One of them, however, no one wants to undergo. Among the 4 stages, the first one is known as induction. Unconsciousness doesn't take over you immediately after you've been given anesthesia. It takes a few moments for the effects to kick in. A strange feeling of being lightheaded is common. In fact, your mind will not function quite like it normally does. If you feel a tingling sensation, that too is expected. Primarily, you will notice the lack of pain. Any pain will be almost non-existent before you fall unconscious. This will be your cue that the anesthesia is doing its required job. The next phase is actually pretty short, so much that you possibly won't even remember having gone through it. As you experience this type of amnesia, your body will panic and lose control. When the unfamiliar substance invades your body, this basic function of the body begins to go a little haywire. This includes basic tasks such as breathing, thinking, and almost every other bodily function. Your mind will get the signal that something isn't quite right and attempts to save you by responding to the sedation immediately, and in somewhat of a vicious fashion. Your body jerking up, a fast noticeable change in breathing rate, and even the heartbeat is all expected to go up or down. Choking and becoming nauseated is also experienced in some cases. Whatever the case might be, don't stress yourself about it, as someone will be watching over you. Surgical anesthesia, the 3rd phase, happens to be the most vital among all the phases. Out of the 60,000 patients who undergo surgical anesthesia a day, you should probably know that unconsciousness due to anesthesia is not at all like sleeping. It's more than that, even bigger. Surgical anesthesia sends you into a mini coma. While being unconscious and being in a coma sound like they would be the same, they are actually 2 separate things. According to some studies, being unconscious makes your mind show 3 stages of non-REM sleep in EEG readings. Whereas if you're under the influence of anesthesia, your brain will not register these readings, hence indicating that you're in fact in a much deeper sleep than you would normally be in. At all times during your surgery, an anesthesiologist will monitor you closely in order to make sure everything goes smoothly. The last thing you want to do is wake up in the middle of a surgery. The 2nd phase might cause you to vomit, which can lead to choking as the body is not functioning correctly. Chances of seizures can also arise, but only when you're fully under the drug do the majority of risks become a bigger factor. Anesthesiologists search for many things all throughout your surgery to guard you from any possible negative reaction. Fluids can reach into your lungs, which can prompt pneumonia or contamination. Even a stroke can happen when you're under anesthesia. A prevailing problem is going into the 4th stage, indicating that the sedation might be too strong for your body to handle and may cause your heart and lungs to stop functioning. Anesthesiologists look for all these things during your surgery, and for good reason. Okay, you've successfully come out of the surgery and into the recovery phase. What comes next? Simply waking up is not an option because you haven't simply been sleeping, which is why your brain needs a restart button. Research shows that when your brain begins to reboot, it starts in tiny bunches. Not all parts of your brain come into its senses all at once. The mind fires up bit by bit, hopping between zones since it's attempting to sort out how everything links up with one another. In essence, your mind shuts everything down to relink and see where things lead, and this, at last, results in full consciousness. Studies even suggest that during this reboot phase, the brain may even regress briefly towards a more primitive evolutionary state. Like what you saw? Check out this video. Want to keep updated on future videos? Then be sure to like, subscribe, and hit the bell to never miss a single one here on Mostly Everything.